Good afternoon. Today we will present the good practice of the Umbria region, called Reports Online. Thank you all for taking part in the interview, and I leave the floor to Matteo Minestrini to introduce the digital solution. You are welcome, Matteo. Thank you.
Good evening all. My name is Matteo Minestrini. I am a radiology technologist, a computer tomography technologist, a nuclear medicine technologist, and a PET technologist in the hospital of Perugia. The healthcare system in Italy is divided in local facilities called USL and in hospital facilities that are just called hospital. Today, we are speaking about the digital revolution in the USL1 of Umbria, which is the biggest healthcare facility in the region of Umbria. The revolution started in the year 2000 when the first RIS-PACS system were installed. Then, just 5 years later, teleradiology was implemented to handle a neurological urgency in the territory of the Tiber Valley, in particular in the territory of the town of Assisi. In that particular moment, the patients that were going to the first aid were asked to undergo a CAT scan in the hospital of Perugia. That would mean to move from the hospital of Assisi 40 kilometers far. That would mean a delay in the cure and a delay in every kind of therapy that was kind of long, especially in patients that were having an ischemic act on the brain. So teleradiology was implemented to reduce this delay and allow the patient to get treated faster. In the year 2013, we were starting to think about the online withdrawal of reports. That would have been a great revolution, not only in an economical aspect, but even in the aspect of the other stakeholders, which were the professionals and the global population. Withdrawing your report online doesn't just allow you to get it fast and get it at your home, but allow you not to move. And so it's a green alternative to the many travel by car that the patient would do to get their reports. And so like that, we can even reduce the ecological footprint of our healthcare facilities.
Good evening, I'm Verona and I'm a student of Radiology Techniques at the University of Perugia. Today I'll make some questions to Matteo Minestrini about this digital revolution that took place in Umbria. How long did it take for the mHealth practice to be implemented?
As I said, in the year 2000, the first RIS-PACS systems were installed. And in the same year, even a digital signature system was implemented in our USL. So it was kind of fast. So it took just 13 years to be perfectly ready for the online withdrawal. And after some feasibility study, we were ready in the year 2015, to be precise, in October, to give the first online records.
Okay, and what are the case steps that were undertaken?
Well, first of all, it was a feasibility study because we had to evaluate the volumes of the examination that we were performing to install a system that would be able to stand the load that would have been on the network. And that, of course, had the best results, so we could proceed.
What are the strengths and the weaknesses of the implementation system?
Strengths and weaknesses. We didn't have weaknesses in general because we were already technologically ready, and everything was pretty cool. Indeed, even the problems that we found, they were mostly about lost codes or things like that, and it was less than 0.06% of the total.
Okay. What stakeholders needed to be involved for the good practice to work?
Well, the stakeholders, as I said, are all of them, the global population, the patients, and the professionals. But at this level, I'm sure to say that the professionals were the stakeholders that needed to be involved most of everybody. because they are, of course, the spine of our healthcare systems.
How was involvement and buy-in of the stakeholders secured?
We faced a problem that was the one of the digital culture. Italy was a country, and is still a country, where the analogical culture is strong. The paper, the writing, history. So we had to implement a plan of education of the professionals to secure their involvement in the practice of the online withdrawal of records.
Well, were there any obstacles you experienced? How were they overcome?
So basically, we didn't find any technological, political, scientific, or legal obstacles because, as I said, we were already having a secure system for the withdrawal of records. What we found indeed was this problem about culture, but that was overcome really easily thanks to education.
Then what were the main outcomes of implementing the mHealth solution?
Let's say that the most important thing, everybody's saying nowadays about social networks and everything like that, is the connectivity. So it's to connect people to our national healthcare service, and that's really, really important. Then another important outcome was that the patient would have his examination whenever and wherever. And that can be seen as an improvement, a general improvement of the quality of life. Then it's sure that a technological evolution is giving us even the possibility to have an economical gain. I'm sure to say, because our study of 2017, which was published on Italian journal Radiologia Futuro, which means radiology and future, this technique allow us to save about 500,000 euro a year. And that's a lot of money that can be invested to improve our healthcare facilities. And then another important aspect, which wasn't considered at the beginning, it was that during a pandemic, it's really important to keep people inside, to prevent people from moving when it's needless. And indeed, the result of the SARS-CoV-19 swabs are withdrawn online, even though.
Well, what is now the status?
Well, the project is completely functional since 2015, so the status is really good. And as I say, the problems that are found in this kind of system are declining during the year. So we passed from 0.07% of critical event to just 0.05%.
What would you have done differently?
Well, honestly, I believe that we wouldn't have done nothing differently because everything was working pretty well. We succeeded even to increase the engagement of the population to the withdrawal of online records, thanks to a call center that we established with radiology technologists. And this call center would help people to understand the benefits, not only the usage, but even the benefits of the possibility of getting their report at home. Another thing that is really important is that people can, of course, even after a lot of time, request again codes and get their report even after the 30 days when the codes would expire.
Well, last but not least, what are the future plans for exploiting the mHealth solution?
We implemented a radiology system that would allow the withdrawal of reports. We have now the laboratory. We would like to add even gynecology, endoscopy, ultrasound, EKG, everything that is possible to this system because it's really working well and it's saving a lot of money to the taxpayers.
Well, thank you.
Thanks to you.
Now I'd like to introduce you Francesca Papa. She is a student of engineering at the University of Perugia. She will show you how our portal works.
Good evening, everyone. I'm Francesca, and with Pasquale, we're going to show you how to collect your reports online. So On the day of the exam, you are given a sheet of paper with some codes on all the information that you need. Then, when the exam is reported, you go to the website uslumbria1.it pagina reperti, and here you can find, as you can see, lab report, radiology report, gastroenterology report, and pathological anatomy report. So let's see the first one. When you click, you press there, and you can fulfill here the form with the codes you had before. So we can see, for example, these. You put extract, and then you can download them directly from here. So you can save them and directly see them. So we can go back to the main page and see how it works for the radiology one. So you fulfill them with the codes you have directly by copying them if you have the PDF form. Okay, here we can see the report. There is signed by the doctor, and you can also see the images. And on the images, you have a tool for visualization, which may be useful for the clinician for express a second opinion. Like you can measure, for example, a nodule, the length of a nodule. Okay. And this is smart because you can send the image everywhere and you can get a second opinion that is important maybe. And so you can also save, of course, the picture in a DICOM standard. You press export and you download them, easily download them and save on your desktop or on your smartphone, of course. So if we go back to the page, you can also evaluate the service. You can evaluate the service to help increasing the system, of course. You can say if you're satisfied or not by the system. Pressing the, and you save. Okay. Of course, online records has an important role during this pandemic year because people that did molecular swab, for example, didn't have to go back to the hospital to get the report, of course, and they could do this by a smartphone at home, for example. You just need an internet connection, so for us it's important because they reduce the risk of contagion with this online report, and they let we can say they let travel images instead of people.
In conclusion, we might say that the path through a easier life, a better quality of our healthcare systems, and a better affordability of our healthcare system is passing through the technology. Thank you.